All right, I think in the interest of time, we're going to go ahead and get started. I'm John Mellinger, and I have the privilege of co-chairing this panel with Dr. Caprice Greenberg, who is the chair of surgery at Augusta University, and a thought leader, as many, if not all of you know, around the use of coaching, amongst other things, in improving our performance as surgeons. We have a really great panel of speakers this morning who are going to help us focus on the theme of educating the surgeon in practice. I'm just going to start with a couple introductory comments. Neither Dr. Greenberg nor I, as the moderators, have anything to disclose. And I think we all know that surgery, it's not something that we're fully equipped for when we finish our training, that we continue to evolve. And if you look at studies of outcomes from a variety of contexts, this particular study I've noted here was done with a junior cardiac surgeon, just looking at the course of his own outcomes as a function of his practice. And the key point, and I love the last quote, there aren't that many things that improve with age ultimately, but we do all improve in our performance over probably at least the first 10 years based on data. This were some outcomes from that study of cardiac surgery, and it showed that on key indicators like mortality, pump time, perioperative MI, bleeding as a complication, the rates all diminished for about 10 years. The study terminated at that point, so it didn't mean that these things don't continue to improve as our careers evolve, but we know that they can plateau, and probably many of you have read Atul Gawande's wonderful article from back in 2011 in the New Yorker, where he talked about his own personal experience with this and reaching a plateau point in his own outcomes about 10 years, as I recall, into his own practice post-training. And at that point, started to use coaching as an element to improve and saw his outcomes start to, again, improve. So this is something that's out there in our popular literature as well as our academic literature. We all know that the ways we evolve and the ways we get better involve multiple elements, including knowledge, skills, as well as attitudes and behaviors. And we're going to try to touch on various aspects of those through the speakers that you'll hear this morning, all of whom I know are outstanding in what they'll contribute. So this is our lineup. It's an all-star crew. I'm going to begin by introducing Dr. Lidor, and then Dr. Greenberg will introduce the remaining speakers, and we'll have some panel time at the end. All of them are truly outstanding. Dr. Lidor is professor of surgery at the University of Wisconsin-Madison. She's the chief of minimally invasive and bariatric surgery there. She's been a SAGES board member, and she's a tremendous contributor to the work of this society and to surgical education. She's going to talk to us about how we stay current in our cognitive knowledge. Ian?